So today I'm going to talk a little bit about dry drunk syndrome. So this is something that is common amongst people in recovery. So just going to give you a little bit of an understanding of because you'll often hear the term dry drunk come up quite a lot. And when that comes up, you may or may not understand what it is. So it's quite common in recovery terms as well, in terms of what we sort of call white knuckling. But it's something, it goes through a little bit more complex than that. So I'm just going to run through that and just explain, what it is. So I'll just run briefly through the introduction. Is that there's a difference between sober and being in recovery. Recovery involves a lot more than putting down the substance. It is a change in behavior as well as lifelong abstinence. Using substances to numb one's emotions stunts their emotional growth and affects an individual's morals and values. Long-term therapy is important when looking to achieve a lifelong journey of recovery, an entire lifestyle change. Just removing the substance will not help in fixing years of substance abuse. This disease of addiction requires long-term therapy and support. They need to be honest, open-minded, and willing to change behavior and thinking. If these changes are not met, they will be clean and sober, but not happy, joyous, and free. Some people don't make the necessary changes and are left angry and miserable and depressed. And this is what is known as dry drunk. So a lot of the times I can also say to people, it's very easy to stop the drugs and the alcohol, but the difficulty is in staying stopped. So it's very easy to put the drugs and alcohol down, but if you're not making the lifestyle changes, if you're not working on the behaviors, if you're not working on the dishonesty, you're still going to behave like an addict or an alcoholic. You're just not going to have the substances or be using the substances. And that's kind of essentially what we call either white knuckling or commonly known as dry drunk, where people are just trying to stay clean by themselves without any help, without any program, and nothing is changing in terms of their behaviors. Okay, so what we look at here is when we look at what is dry drunk. People will often use substances addictively for many reasons, such as genetic predisposition to substance dependence, trauma, social conditioning or home environments, the inability to cope with life circumstances, and negative core beliefs about themselves or their lives. So when we look at how we treat patients that changes, we base it off a biopsychosocial model, excuse me, guys, where we look at the three sort of main aspects of addiction, which would be your biological. So that would be where we look at the medical side, the psychiatric side, any predispositions to substance abuse. So we use a lot of we look at a lot of that. We look at the psychological side, which would be the traumas and the behaviors, social conditioning such as home environments where they live, peer pressure around them. So that's kind of the model that we use at Changes Treatment Center, just to obviously work on all aspects of addiction, because a lot of there's so many different causes and triggers and reasons why people drink and use, so we have to tackle it from all angles. Otherwise, if we're not fixing it, then we end up just having them repeat the cycle over and over again. When we look at substance abuse, that's generally only the temporary solution to the problems. And that's why I say when we put drugs and alcohol down, it's very easy, but then we can't carry on and live life in sobriety if we're not changing anything else. So simply quitting the substances without changing lifestyle or other behaviors and thought processes is not enough. It does not take away the problem the addict or alcoholic was trying to resolve in the first place. So the most common ones we hear in treatment is like, I'm drinking because I'm depressed. I'm using drugs because I'm stressed out and it helps me calm down. Or, there's multiple reasons why people will use and drink, so. But if I stop drinking, that problem is still going to be there. If I don't learn how to cope with conflict, if I don't learn how to work through my depression, if I don't learn to deal with any of these things, it's still going to be there. It's still going to be there. It's not going to go away. If addiction is not replaced with a healthy pattern of living, they may end up feeling empty, discontent, and full of anguish. This is what we call dry drunk syndrome, where an addict or alcoholic has no drugs and alcohol, but also no solution. I often say with dry drunk, it's going to be like you're going to put the alcohol down, you're going to try and fix your life and try and control it, but you're still going to feel like you're drinking because your life is still going to be unmanageable. You're still going to feel the same way. Nothing is going to change. All you've done is stop drinking. It doesn't actually change anything else that happens through that, through that process. Okay. So when we look at recovery, is not just the abstinence of alcohol or drugs, but a new way of life. They need to they need a complete new lifestyle to replace what they had. They can be left with the following when only remaining abstinent from substances, which could be pain, fear, emptiness that prompted the abuse of substance returns, and then the individual will end up suffering through abstinence or return to active addiction. And again, this is where we say there's a lot of sort of maybe emotions or fears or insecurities that someone might have, and that's why they drink and use, so they'll, or at least that's why they say they'll drink and use, so they'll be able to, grief is a big one that comes up, is that, I've lost someone that I love dearly. I can't cope with it. I can't deal with it. So I'm going to just use. I don't feel good enough about myself, feelings of worthlessness. All of these, I mean, I could go on, but we could go on all night in terms of what, could be aspects of why people drink and use. But if they put the drugs down and they don't work on the feelings of worthlessness, for example, if they don't deal with the grief, they're going to just end up returning to active addiction anyway. There's a difference between being clean and being in recovery. So when we look at being clean, it means that one is abstinent. They're only abstinent, so they've only just put the drugs and the alcohol down. They'll still be dishonest. They will still continue with addictive behavior. They'll still hang out with dangerous people and hang out in dangerous places. There'll be a lot of preoccupation with regards to, the good times, and it wasn't that bad, and there weren't really consequences. So there'll be a lot of that preoccupation and then also obsession around, the situation that is obviously making them use, or they'll be obsessing about people that they used to use with, or the good parties or the good times, and how the drugs help them cope. And that becomes an obsessive thought that then inevitably leads to relapse. Also, your loved one might just be very irritable as well, because I put the drugs down, I put the alcohol down, there's nothing here to calm me down, so I'm just going to be irritated and drive everyone insane and get angry with everybody. When we look at recovery or being sober, it means that someone is working a program, they are practicing their 5 pillars. You will notice changed behavior. They'll start practicing a life of honesty. They will deal with trauma and circumstances effectively. And normally with that, extended treatment is a good way to help them with that, because a lot of the times we'll get people that will come into treatment, they'll work on themselves, they'll do really well, and after 21, 24 days, they feel, okay, I'm ready to go out and tackle the world. When in fact, they 9 times out of 10 generally aren't. And this means that, that's why sometimes there needs to be some kind of extra therapeutic support to help them get into the program of recovery, because a lot of people will say they're going to do it and then they leave treatment and then they don't end up practicing their 5 pillars or doing a program of recovery. Okay, I don't know if Lindy or Cheryl want to add anything before I move on.
Basically what dry drunk means is not using, as Dom said, it's not using, but also not recovering. So in treatment, the way that I see it, someone would just attend, group sessions and not share anything, just come to group and just sit down. And when counselors challenge him or her to share on the consequences and severity of their addiction, they won't share. They will just say, I don't have consequences. I don't know what to share. I don't know what you expect me to do. So that person is basically planning their relapse while in recovery, right?
I also think it's got a lot to do with how we feel, how we feel around them. when our loved ones in recovery, we don't have those doubts and those questions and those anxieties. We have them when they're dry drunk. That's when we start to look out for things. We start to be cautious. But we as family don't feel okay. And that's generally a good indication that there's a dry drunk. If we're not seeing the participation in recovery, hopefully we saw it at some point, either just post-treatment, maybe during treatment. If we're not seeing that, it's not happening. There is a question now, Dom. I don't know if you want to answer it.
Yeah, I think I saw it. Is it the one about the 5 pillars? Yeah. So yeah, I think we did do a presentation on this about, was it 2 or 3 weeks ago? But I think just to run through it quickly with you, it's something that they practice as part of the 12-step program. So there's your meetings, which are like your NAAA meetings that they would go to, like support group meetings. They have a sponsor who is someone who has been through the 12-step programs, been clean in recovery for a minimum of 2 years onwards. Someone they can phone to obviously help them with their cravings, someone they can do their step work with, and basically a mentor that can guide them through their recovery. As I mentioned, they'll do step work with the sponsor, which is really the sort of the 12 steps of the program, where they can do written work, it can be verbal. And what they do is they do this through the program, and that's obviously how they start making amends and working through angers and resentments. What we also do is encourage them to get service positions at these meetings. So whether it's setting up the tea and coffee, selling the books, chairing a meeting. So there's different positions within the fellowship that they can do, which helps keeps them accountable and go to meetings. And then the last one is a connection to their higher power. So whatever they believe in, they would obviously connect with that, and work with that. So I think if you would like some more resources into that, you can always just pop the counselor's phone a message, and we can possibly send you some more resources for that. Otherwise, I think the presentation might be on YouTube. We can always have a look and see if it is up there. So yeah, that's just a brief summary of the 5 pillars. Okay, so if we look at, oh, sorry guys. Okay, if we look at some of the symptoms from dry drunk, so sometimes you may or may not know, because if you as a loved one sort of doesn't really understand what a program looks like, what it's meant to look like when they're in recovery, sometimes families just put their loved ones in rehab and think, okay, they're going to get fixed now, and they're going to come out and everything's going to be fine. I wish that was the case. It's not, sorry to say, but it's, it requires a lot of, it does require quite some work from the family side, but it also requires a lot of work from their side in order to stay clean and sober. But what you can do is, I always say that when your loved one comes out of treatment and they're working a program of recovery and things are going well, and you will notice straight away in the behavior if there's something that's not right. If they're not going to the meetings, if they're not seeing a sponsor, you'll start to see that old behavior will start coming back, which I've put sort of in there, which is the lying or the manipulating. They hold on to resentment. They hold on to anger. They'll struggle with ego or feelings of being inferior. So they'll either go one or the other. They'll feel superior to others, or have feelings of being inferior, of not good enough. A lot of the time they'll start comparing their recovery to other people's recoveries. Like, I saw Joe Soap, sorry guys, I saw Joe Soap at a meeting, and he's got the wife, got a promotion at work, driving the Ferrari, like, why don't I have all of that? I've been out of treatment for a week and nothing has changed. Sorry, that's a bit of an extreme example, but that's basically what I'm trying to sort of paint a picture. Is like, they'll go to a meeting, they'll feel like, okay, well, recovery's not working for me because I don't have what that person has. But in turn, they're actually not working their recovery as they should be. You'll find a lot of mood swings, irritability, lashing out, outbursts, They might start engaging in compulsive behaviors or non-substance related addictions. I think there is a little bit of this in later on, but there's something that we call cross addiction, where it would be, it's not just like I didn't have a problem drinking, I just do drugs, I can still drink, and then they become alcoholics. Sorry guys. And then they become alcoholics. But also we have what we call process addictions. I think I've mentioned in a few of my presentations before, but process addictions are things like sex and love, gambling, food related, stuff, codependency. They'll start looking for, because a lot of the time with addiction, it's always looking for an external source to make me feel better internally. So if I no longer have drugs and alcohol and I'm not working on changing my behavior or a program of recovery, I'm going to start looking for other things that are external to make me feel better. I hope that makes sense. I think it's the best way I can sort of explain it. So a lot of people will often find that, in other addictions like gambling and sex and food. So that's where they may become emotionally or physically abusive. And obviously, the lying and the manipulation will come back, and they'll start being dishonest around what they are. So there's quite a few symptoms. So I'm going to try and run through them quickly, but also not too quickly, if that makes sense. There's a lot of isolation from family or friends will come up. I think isolation is quite a big one, because it's very common where, a lot of addicts and alcoholics, because they're so full of the guilt and the shame that they have from drinking and doing drugs, they don't like to show themselves in front of family or friends, so there's a lot of isolation that will happen. If they're not connected to a 12-step program or a program of recovery and connecting to other people in the fellowship, and they start isolating from that, that's also a big red flag, because in recovery, they should be connecting with other people. They should be going to fellowship meetings. They should be doing all of that. So that's usually where we have that isolation from family or friends. They'll start engaging in high risk behavior. I think I mentioned in a few slides back, where they'll start hanging out with dangerous people, like their old using friends. They'll start sorry guys. So they'll start hanging out with old using friends. They'll start hanging out in like really dangerous places. They'll start doing a lot of stuff that's very high risk to them. They might deny, minimalize, or rationalize their addiction as well, and say, but it wasn't that bad. I went to treatment, I got help. Maybe I can control it. One drink is not going to be a problem. What is one going to do? I know I used to use with this person, but they know I've been to rehab. They're not going to offer me drugs. They'll start fantasizing about drinking or using and returning to that obsession of like how good it used to be. We always say this is a disease of forgetfulness. So the longer we sort of stay in recovery, we start forgetting about how bad the consequences are, which leads to, obviously, I can just, sorry, I don't know what that's about. That was very random. The most random message just popped up on my screen. Where was I? Yeah, so they'll start fantasizing about how good it was, and they'll kind of forget about the damage they've caused themselves, the damage they've caused other people. They just kind of start obsessing about the good times. They will display disproportionate reactions to life events like overreacting or not experiencing emotional reaction to intense experiences. So something really small might be really big to them. Okay, I've mentioned that one. Obviously they'll stop working a 12-step program and stop attending support groups or therapy. And then they'll also start to struggle to relate to other people in recovery. So when I say they're comparing recovery to others, it's like, I can't relate because I don't have the wife, the Ferrari, the promotion. I've got this and this and this, and this person's got so much more than me. So they start also looking more at materialistic things of recovery instead of actually what recovery is giving people in the long run. Okay, and then lastly, they will develop destructive coping mechanisms like self-harm. They'll fail to treat any mental illnesses which can be physically and emotionally harmful. This one is quite common. We have a lot of people that, you know, they come into treatment, they see the doctors, they get a prescription of medication, and then after their script is complete, they're like, "Sharp, I'm good, I'm fine, my medication's helped, everything's good." They stop taking the medication, they stop following through with the doctor, and that often leads to relapse quite quickly. You know, because they're not doing it in a managed way, if I can call it that. So it's really important that when your loved one does eventually leave treatment, that they follow through with that process. And if at any point they do want to come off any medication, that they do that with the guidance of a doctor, you know. So it's not a case of, okay, well, I got the script, it's finished now, I'm done, I don't have to carry on taking my medication. And then they also refuse to admit to or recognize their behavior and the impact it has on themselves and on others. So that's where the denial starts coming back in, where, I mean, I'm sure there's a lot of you that have had your first family conjoint and your loved one turns around and says, "But you're lying. I never did any of that. You know, like, you're overreacting. It wasn't that bad." Because they can't hear what you're trying to express, you know, because that's that denial. It's just like, it wasn't that bad. It wasn't a problem. I don't know what the issue is. You know, so that's really where that comes in. Okay. Lindy, I don't know if there's anything you want to add, or Cheryl, then I can move on.
No, not at the moment.
I'm good, thank you, Dom.
Okay, so let's look at what we can do to overcome dry drunk syndrome. Very straightforward and very simply is asking for help. You know, a lot of the times my life is unmanageable, I'm not coping, I'm just experiencing consequences. You know, I need help. It's nothing is changing. I've tried stopping, doesn't work. Let me see what else I can do. They can do that through seeking out treatment or counseling. So it doesn't necessarily mean rehab, although it's very difficult, you know, without some kind of contained environment and focusing on yourself to stay clean. So it's any kind of treatment or counseling would be very beneficial in terms of helping to get into that practice, get into the program of recovery and start practicing the 5 pillars. You know, get to a meeting, get a sponsor as quickly as possible, start working your step work as quickly as possible, so that you're not stuck thinking about, oh, how am I going to get over this? A lot of the times you can also revisit your sustainable recovery plan, and look at what are you not doing that is necessary for your recovery. So your loved ones counselors will do a sustainable recovery plan with them before they do leave treatment with us, whether that's them completing primary care, whether that's them completing secondary care, whether they're leaving a halfway house. There's always a relapse prevention contract or a sustainable recovery plan that's usually put in place. And that's between the family, the loved one, and then obviously the counselors will put that all together. But sometimes when you have a recovery plan, you need to go back and look at, okay, what's working and what isn't. You know, life changes, things change, situations change, and you need to figure out what is the best thing for you to do that will aid you and guide you into a recovery process. Okay, let's look at how you as a family can help your loved one. There's many ways that you can do it, but what you would do is, sorry, what is this thing and why does it keep coming up? Okay, go away. Sorry, something about a distiller that's not working. Okay, so how do you help your loved one to overcome dry drunk, right? The easiest and most obvious way, or the easiest way, is that they come to you and they say, look, I need help, I can't cope, I'm not, you know, I'm not happy with where I'm at, I need treatment, or I need counseling, or whatever the reason is. So that would obviously be the easiest. But then what you can look at is, in terms of recovery now and where your loved one's at now, is we always look at, so they need to reach out for help. You can help by offering any kind of inpatient or outpatient treatment. Extended care options are usually quite good as well, in case, 21 days, 24 days is usually never enough to fix 10, 15, 20-year addiction. So it's always developing a therapeutic recovery process for your loved one that's suited for them, in terms of the feasibility and that around what they can and cannot do. Always be supportive and kind, but not to a point where you're enabling. Okay, so I just want to have a look in conclusion. Dry drunk syndrome is fairly common in early recovery or people who have only experienced treatment once. Addicts run mostly on self-will and believe they can do this on their own. It is important to be supportive and encourage them to seek out help, or let them know they can communicate with you so that the healing process can begin. When we say self-will, a lot of you will hear it in your last family conjoints where I've got this, I know what to do, I'm going to go out, I'm going to get a sponsor, I'm going to go to meetings, I can control it, I know what I'm doing. These are things that are very, very like warning signs, red flags. They need to kind of, your loved one should be leaving treatment scared, actually, just because then at least they know that they don't have it and they're going to have to work to stay clean and sober. So yeah, I think that's it on dry drunk. I don't know if Lindy or Cheryl want to add anything before we open up to questions and other families.
Okay, no.
I'd love to hear from the parents and families and loved ones on the group, because I'm sure they understand what this means now.
Yeah, I think if anyone's got any questions, feel free to ask, or you can also just unmute yourself and maybe share. So they would all, they would ideally still work a program with 5 pillars in terms of, sponsor, in terms of meetings. But I think in terms of behavior, and that if it would be very much the same as what I've basically explained now, because say, for example, you've got someone who's a gambler and they're gambling and now suddenly they're not gambling. They've put the gambling away. They try to stop gambling, but they'll still experience the same symptoms. They'll still be uncomfortable. They'll still be irritable because they're not using the gambling as an outlet, if that makes sense.
Okay. I think Mandla had his hand up.
What are the disadvantages of somebody coming out of treatment and they can't access face-to-face in-person meetings and they rather need to do online meetings? I think, Mandla, it is a disadvantage. But we know many, many, many people who have cleaned up through going to online meetings. They can still get a sponsor. A couple of people have sponsors all around the country. So they can do WhatsApp video calls, they can do Zoom meets. And when they can get to a face-to-face meeting, maybe weekends, then we would encourage them to try. We understand like maybe places like Lesotho or, really far out parts of South Africa, they may not have face-to-face, but generally we're finding Alcoholics Anonymous, they're almost in every single suburb, township, area, farmland. So AA is more accessible than like CA or NA sometimes. But as long as they're getting 12-step support, getting a sponsor and doing step work, they can do it. Not ideal, but they can. Okay, I think for most people who are in either abroad, internationally, cross borders, cross provinces, we try and recommend that somebody finds even in a treatment center, because often the treatment centers have fellowship meetings that run from them. And there's lots. Sanka has rehabs all over South Africa. And overseas, we would try and find somebody for you to connect with. We also do offer online counseling. So they can stay with their counselor and they can continue with aftercare online. So that still keeps them connected with Changes, and it keeps them connected with the peers that they might have been in treatment with. The whole key is that ongoing support accountability. And that's where the 12 steps step in.
We have a question from Janet. Why do they choose to not recover? I think for me is just the fear of facing pain. We all know that addiction numbs pain, right? So when the substance is gone, the buried emotions come back. Guilt, shame, grief, anger, trauma. So for that, for many, that might feel very unbearable. So instead of healing, they'd rather stay and numb those feelings and also disconnect from maybe people they attend meetings with, just going to meetings and not sharing anything. So it's for them, it's easier to feel nothing than to feel everything they've tried to avoid.
I think also sometimes that they don't want to get clean. You know, they might say they do, they might say they have a problem, but sometimes the denial's just really thick and they don't want recovery. But I think Lindy's example of facing that pain and having to live life without something like a coping mechanism can be very difficult and can be very scary for some people. I think there's a lot of many different reasons why someone wouldn't want to recover, but I think it's pretty much, I think those would be the two main ones for me, is the denial, and then obviously the pain of facing life, you know, without having a crutch. I think you can call it that.
Yeah, I think that is obviously fear of losing identity, because addiction becomes a lifestyle for them. The party one, the tough guy, the victim, the survivor. So recovery means letting go of who they were and learning new healthy behaviors. So they ask themselves, if I don't go back to drinking, who am I without my drug? So it becomes very difficult for them to want to change. Okay. We also have a question. How do we determine that they don't want to get clean when they actually go for treatment?
Cheryl looks like she wants to answer that one.
Well, I think it piggybacks on what you've just said and what you said earlier. People come into treatment for different reasons, different times and different seasons. I've been trying to work with somebody recently to try and help him get in, and he's really fighting. And on one hand, he says, I want to clean up, but in under his behavior says, I want to clean up. And that's what treatment is. Treatment's job, our job, is to try and help them find recovery. Now, it's not that we've got a foolproof method, but the 12 steps really goes a long way in helping them find it. But there's other factors. You know, I think a factor that we struggle the most with is getting the families to work with us as a united front. That's our biggest struggle. And that's, I think, one of the biggest problems they face when they get out, because they are so used to manipulating their families. They are so used to saying things that you want to hear. They're so used to getting what they want. So a lot of the change actually belongs with us as loved ones. And if we get that right, then we often see that they want to recover. So there is a lot of responsibility that falls on us as the family members, and the responsibility is for us to also change and to not be so accessible, so loving, so amenable to their manipulation and deceit. But the reality is, if we think about it, if I can get high and I don't have consequences and my family picks up the pieces, why would I want to clean up?
Mm.
I wouldn't want to.
Mm.
So they still want to escape. And our hope is that the outlet becomes a fellowship and people that they like-minded people they can connect to. But this is why you're all on this platform, so we can help you make those changes. So when they do get out, there's not that many opportunities to use because they'll only use if they can get away with it. If we foot the bill, if we take the consequences, if we pick up pieces, if we go into denial. I think being in a 12-step fellowship already, like Al-Anon, you're already on that process, on that journey. And I do think it starts with us, and I think so does the healing. A lot of times, our chemically dependent loved ones, they can pick and choose what they recall and what consequences they want to deal with, the trauma and the damage that they've caused to their families. So it's not selfish for the family to also start taking care of themselves. And it's not selfish to put our recovery first either, because they're coming home to people they've caused harm to. And if they're not humble and if they're not willing and open-minded, their recovery is going to be very difficult or not. Relapses happen then. So it is important for the families to get help, talk about it, find support. There is live and let live, but I like the blend of the 12-step program of Al-Anon with the program of Tough Love, which says that family problems have roots and supports in the culture. So it's allocating responsibility to the addict and alcoholic and taking responsibility for ourselves of how do I help me get better? Because him or she has to take care of themselves so they get better. It's a long road, but it's doable.
That's very comforting and really, really helpful. Thank you.
Welcome.
There's a question from Zolega. If someone has never been to Changes, would they be able to access a therapist or a counselor program online? Cheryl?
Probably not a program. It really would depend. So what we would do is either myself or Kate would do an assessment and see if we could help them. It's very difficult to do a detox if somebody's not safely ensconced in a treatment center. And also access to a good psychiatrist takes very long. Like to see our psychiatrist takes weeks. And it really depends. There's certain narcotics that I personally won't touch on an outpatient basis or on an online basis. And alcohol is one of them, marijuana is the other. And then any chemicals, pharmaceuticals, because they're just not able to come off on their own.